Hey guys, Dr. Pete here from Precision and Movement. So we've been talking about body pain areas, specifically for runners. Today, the focus is on piriformis pain. So the piriformis muscle is right around the hip area. So the muscle starts right here on the tailbone and it attaches diagonally right through the side of the hip right here. So a lot of times people who have pain in this area, their pain source could potentially be from piriformis. So it'll be vitally important to get assessed by a medical professional, whether that be a physical therapist, a doctor, a movement expert, prior to proceeding with any of these exercises that I'm going to be talking about. So now if someone has pain right there, there are common thoughts that people would think about doing, right? Number one would be, if I have pain, should I stretch it? If I have pain, should I strengthen it? Or if I have pain, I don't know what to do. So today, the first step is to, if you do have pain in that area, perhaps you should try to stretch the muscle. Now, why should you stretch a muscle? Sometimes when you're going about your daily life or you're doing activities such as running, you might be compensating and overloading the muscle. Hence, you might have to stretch it. Stretching is a form of relaxation. It's a form of lengthening the tissues. So if you're able to lengthen the tissues, there's less compressive stress in the hip area. So let's take Sharon through one common exercise, one example exercise that you can try this at home, okay? So go and lay down on your back. Now if you Google search any piriformis stretches, it's probably gonna show up like this, but I'll just be keying in on certain aspects of the stretch that you should try to focus on, okay? All right, so you're on your back, you're relaxed. Again, stretching is a relaxation thing. We're trying to lengthen tissues, right? So the first step you can do is just bend your knee up towards your chest here. Perfect. All right. So again, the piriformis muscle is right behind the hip. So what you want to do is you can rotate the leg right here. Go and hold your leg like so. Perfect. So one hand can be holding the ankle. The other hand can be holding the knee. All right. So because the muscle is a rotator muscle, you actually do want to create some rotation into the leg, right? So perfect. And then after that, you should be feeling a pretty good stretch here. If you don't really feel it yet, you can actually pull this knee across the body. And normal length is around, the knee should be right in the middle of your body, like so. So again, number one, you should be winding up the leg a little bit. Number two, you should be pulling it across the body. And number three, you should feel it back here in the hip. Now, if you feel it in the front of the hip, that might denote another issue that we can definitely talk about another time. But if you're having any kind of tightness sensation right in the back of the hip, you might be having some piriformis muscle length issues, and this could be one possible exercise for you to try at home. So with any kind of stretch, you want to hold for at least a minute. You want to breathe, relax. Again, it's a relaxation technique. Hopefully it can create more circulation, less tension in the hip area, and less pain, therefore.